Good afternoon, everyone. I am Kimberly Price. I am on faculty at Lenore-Rhine University in the Public Health program. And it is my privilege and honor to be able to moderate this breakout session. This is one of the first breakout sessions that we're having today on health impacts of climate change. And we're going to be focusing on farm worker heat health. We have two special guests. We have Laurie Thie, who is an environmental program consultant for the North Carolina Department of Health and Human Services. And we also have Roberto Rosales. He's the lead educator for Farmworker health and safety education programs with the North Carolina Cooperative Extension. And you may recall that Roberto spoke earlier on the panel that we had earlier this afternoon, and talking about his frontline experience. And he'll be able to share some more information about his experience with heat health with farm workers. But before Roberto, we'll have Laurie Thie, who'll talk a little bit about health, about the health impacts of climate change. And if you have any questions, if any of our audience members have any questions, please feel free to submit your questions in the Zoom chat or in Whova, and we will relay them to the panelists. So without further ado, I will turn it over to Laurie.
Thank you. I'm going to pull up my slides. So welcome everyone, and as you can probably see, I've got my shot from my second shot of my vaccine today. So those of you who want shots and want vaccines know that those are more available as each day goes by. I want to share a little bit with you about the heat-related illness data that we have at the state. I know some of you may have seen some of this information, and to some of you this may be new. And I did want to point out that Autumn Locklear, our North Carolina climate and health epidemiologist, presented some of this information. Most of this presentation is based on her presentation at the EcoAdapt Rural Heat webinar in 2021. So you can find that online if you'd like to watch what she presented, along with one of our partners from Sustainable Sandhills presented there. So just a little bit about our team. We're in the epidemiology section of the State Health Department. We're funded by the CDC Climate and Health Program. We have a number of ongoing heat health efforts where we really work with partners, partners like Roberto, who are really the experts at sort of like farm worker heat health work going on down at the ground, but try to support them and magnify the information they can share with us from their localities. So the data I'll share with you comes from the NC Detect system, which is our statewide syndromic surveillance system in North Carolina, which is a epidemiology speak for our like statewide emergency department, emergency medical services, urgent care centers, and poison control data. And we pull from both kind of the triage or nurses notes and the chief complaint, which is the reason people give when they go in the emergency department for why they're seeking care that day. And this is all a partnership between UNC, the State Health Department, and NC Detect. So here's an example of our data. Here's the 2020 heat season data that Autumn Locklear put together. The blue line is the North Carolina Emergency Department visits, and that you can see the magnitude of that if you use the y-axis on the left for daily visits. So you can see, like in July, for example, are some of the largest peaks for heat-related illness, although we certainly saw another peak around September 2nd and Labor Day weekend. And then we've also got some weather data on there from our partners. So the daily maximum heat index at the Raleigh airport, because that seems to be kind of like a central location for heat illness, although certainly not indicative of all local conditions. And then the green line, the average max heat index for the location of that emergency department visits. And all of our weather data comes from our partners at the State Climate Office. And I did want to present, Roberto thought it would be helpful perhaps to share about historically the patterns we see. There was a student, Kalyani Hallwood, from UNC, who did an analysis of 2009 to 2017 heat-related illness emergency department visits in North Carolina. And over that time, sort of the biggest trend she saw when she looked at this data was when you kind of look at 2013 to 2017, the increase of these peaks of heat-related illness, peaks kind of being like here where you can see like the weekend of July 20th, where that blue line shot up, or September 2nd. And so just, you know, we need more research into this area, but we presented this at the Council for State and Territorial Epidemiologists annual conference in 2019, that just we seem to see an increase potentially in these upticks of illness. Is the biggest pattern so far. And here is our website for our heat health data. You can email me on that website. There's like my contact information if you want to receive weekly heat reports. Otherwise, May through September, they're posted on our website. And we do daily, weekly, and aggregate counts. We're working all the time on creating breakdowns in response to partner requests. So also feel free to email about that. And see what else. Oh, we also have a map. So this gives you a little idea of the geographical distribution of illness. And so it's the percent of the total emergency department visits during 2019 that came from heat-related illness. So as you can see, it's a small number of the total emergency department visits generally are for heat-related illness. Although, you know, we certainly just looked at the heat-related illness. So if you included other illnesses that might come from heat exposures, probably be a greater percentage. And there you can really, I think, see the concentration in the central and eastern parts of the state, and then also in some of the eastern and southern parts of the state with heavy amounts of agriculture. And just some limitations. You know, one struggle we have is to specifically pinpoint heat-related illness from farm workers in the state. So we don't get, currently, we get a few federally qualified health centers. This sentence should have been corrected, I'm sorry. We do get a little bit of that data into the NC Detect system, a few urgent care centers, and a few primary care providers. This information is increasing all the time from these sources, but currently not all of them are represented, and it's newer information that's coming on from them that we haven't historically always had, I don't think. And emergency departments do not report on income data, so that it's kind of hard. Like some of the illness from farm workers may come from, they don't make high enough wages or have access to adequate cooling. So we don't always know how to assess like the economic component of the exposure and the illness we see. And certainly most people, and certainly relatively healthy group like farm workers, probably will avoid seeking medical attention for heat-related illness. So to remember that this is truly a large underrepresentation of the illness. And then just here's our contact information. And I always like to share at the end of my presentations that hopefully what we're moving towards is a future that looks like the image on the left, where the cities and the countryside are kind of these scorched places during extreme heat that's ever increasing. And how do we work together to create, you know, what's on the right, which is this place that during hot days still seems inviting and like somewhere we want to all work and live. And I really appreciated what the speakers earlier today said as far as, you know, like we have the data to act. And I think, you know, Roberto will talk more about the day-to-day actions he's taking in this field. Let me get off of the sharing. I can't hear you, Kimberly.
Thank you so much, Lauren, for sharing. And now we'll turn it over to Roberto, who'll give us more information about what is really going on the front lines.
Awesome. Thank you, Lauren, and thank you everybody for joining today. I think it's world that a lot of people are not as connected nowadays with the ag community and where their food sources come from. So be me being working with NC Cooperative Extension, I've been with them 4 years now, and that's one of the things that I've learned that we need to do better in connecting not just the people that are working with our food and where our food is coming from, but also the people that consume it. And so I think a lot of it has to do on the ethical parts of, how do we grow our food and how do we make it sustainable at the same time. Agriculture has always there's always been challenges. My parents worked in agriculture since the 80s here in the United States and even back home in Mexico. And so it's always been challenging to address all of the hazards that come with agriculture. I think it's one of the most dangerous jobs for a reason for the combination of risk factors on the farm that are just sheer nature of agriculture. And I think one of the things that I've learned more recently that agriculture is a professional job. I think it takes a skill, a trade, to work in it, and I think it should be treated that way. And one of the ways that I, allow that or help, facilitate that is through the trainings that we do. So basically, what I do, I go out to the farms and help the farms become, or stay in compliance with some of the trainings they need to provide for their workers. What really drives our training are some of the policy and regulations that are required from either state regulations or any certification bodies like GAP Connections or FSMA, food safety standards. So in order for them to meet those requirements, they need to provide some administrative paperwork and maybe detailed process of how they do the work or do the cultivation. But then also part of it is to make sure that they're training the workers on safety topics. And for the most part, especially since a lot of farms work with pesticides one of the biggest topics that we cover. But with the farm workers here in North Carolina, especially in Eastern North Carolina, we talk a lot about heat stress, especially as we saw in Lauren's charts. We see those peaks, those spikes happen in July, August, and it's just mainly just location and also some of the effects of climate change. And so uh, part of the conversations that we're having now is, how do we plan for the future? And in the state of North Carolina, we usually have about 70 to 80,000 workers farm workers that come through the state of North Carolina. Now that doesn't mean that they're all here at once, but they travel here, if for a certain harvest season, blueberries, strawberries, and then they go to another state, apples. Um, but then sometimes, they're here for 10 months. So there's a lot of dynamics within the farm worker population, and that's changed over the last 5 years as the labor force has changed. Before, a lot of the growers, employers depended a lot on the seasonal and migrant population. Um, and so, that's like a mixed population with legal status. And so there's a lot of other concern, external factors that make, seeking medical care, transportation, you hear the situations of workers not being paid, loss of wages, and so there's not really as much protection. But one of the things that's happened more recently in the eastern part of the state is employers have been hiring H-2A labor force, which usually come internationally, mostly from Mexico, but some of them do come from like Jamaica or Haiti, which are smaller numbers, but nonetheless. And the reason I mention this is the dynamics is that all of these groups come from different parts of the world and different climates from where they're from. And so a lot of what you'll hear about heat stress is a climate acclimatization to the area or to the weather where they're working at. And I think that's where a lot of the problems happen when they first arrive. And North Carolina's weather in July and August is very humid, and so not everybody comes from humid areas. Mexico might be a hot place, but not everywhere is humid. And so it's a different type of heat. And the workers that have worked in tobacco, for example, where there's you're working in the rows of the tobacco, it could be a high heat index, but then imagine working in those rows of tobacco, that heat index is going to be even hotter amongst those rows. So part of the training that I do is to talk about those risk factors, things that they can control. So weather's obviously not one of them, but things that they can control are how they prepare for work. And it's a combination of their preparation along with their employer, and having some type of understanding that when it is hot, to modify the work schedules, to maybe end the day earlier if it's if there's a heat advisory warning. And so that all sounds, in an ideal world. There's other external factors in terms of does the grower need to finish these crops, get these out of the land before they go bad. If it rains, what's the situation with the rain, or any natural disasters like hurricane, which are common in eastern North Carolina. And so then you talk about the piece rate. If you're working with like sweet potatoes, the incentive to the harder and the faster you work, the more money you make. That sometimes incentivizes the workers to work beyond the body limits, and that's where we sometimes see some of those situations of heat stress. So my role is to come in there and talk about these situations, and talk with the employer, and what are some things that they can do in terms of working with the worker, and encouraging a safer environment. There's no easy solution. I think there's a combination of uh, partnership between the employer and the worker, but then also at a policy level where right now there is no national standard. And I think Kathy asked the question if there is. Let me go scroll back up. If there is a safety law that enforces AC, um, depending farm workers, there's different tasks and different things that they're doing, right? Depending on the crop and what part of the food systems they're at. So if they're in some type of indoor place, there are some other regulations, not necessarily related to heat, but in terms of ventilation with the space, and making sure that bacteria doesn't build on the crops, or whatever they're growing. But in terms of workers outdoor labor, there isn't really a standard or law in place in North Carolina that protects them. And so in other states, North California or Texas, Florida, there are some other laws in place that protect that. Saying if it reaches a certain temperature, then they need to stop, or they need to take breaks every 30 minutes, or whatever their law says. But here in North Carolina, there isn't. So one of the things that's happening, and this has been going on for years, similar to what worker protection standard is, which is the pesticide safety education on farms. That before, workers only need to be trained once every 5 years on pesticide safety, because of a lot of injuries and deaths around pesticides. That's been changed to now every 12 months workers need to be trained. Um, and additional PPE needs to be provided for workers that are mixing and preparing and applying pesticides. That's kind of what's going on right now with heat stress. There's been a lot of conversations at a national level to implement something that's more standard across the board. And obviously, that's going to affect every state differently because of the climates. But in North Carolina, that would be something that would benefit, especially in those months when we have, the hottest temperature, the warmest days. That just kind of helps the employer making those decisions a little bit more comfortable. So part of our job as extension, and any groups that work with the ag community, would be to make sure that we're communicating that information to the employer, because the worker can't eliminate the heat or the work that's being done. I think it needs to be a collaboration between everybody doing their part to mitigate that. And that's one of the things that I've talked with Lauren and her team in the past. How can we track that information? In terms of like, how are the numbers getting better? We're not at, our program's only 5 years old, and there's been health centers that do outreach programs that do outreach to the farm workers, and a lot of the topics that they talk about when they do outreach are related to pesticide or heat stress. And so, how do we measure that? I think that's one of the questions that I've been working on answering, because we want to make sure that all these conversation, all these educational sessions are, showing some type of effect in that community, making sure that those things are changing, but then also making sure that the employers are, understanding. And just from my personal experience, conversation I have with growers from the different counties in Eastern North Carolina, they really, most of them are trying to figure out ways that can, help out their guys, because if you think about it, it's their labor force, and with the H-2A workers, it they're paying to bring them on. So, in a way they're losing if if they don't have a healthy workforce. Whereas, before the H-2A labor force, where you have seasonal and migrant farm workers, they were more easily replaceable then. And so things are changing in a way that are, positive, and decisions are being more proactive, and avoiding, creating a safer environment, and in those instances. And so what we're trying to do is to continue that conversation. I think it's something that is, through education. I know OSHA has an application that illustrates the heat index wherever they're working, out in the field. So one of the things we push out is for employers to use that as a tool, to gauge and make decisions when the weather is extreme. Make those decisions, like maybe we need to cut, you know in the day earlier, or have more frequent breaks in that sense. And so we want to continue, having those conversations. But that's kind of where we're at with the ag community, and it's, I think it's one of the risk factors on the farms, but there's a lot that are happening around that, and especially as we continue the conversation with climate change, and we have more extreme weather events like hurricanes. That's another barrier there that's happening with farm workers, when there's cases where workers have been left out in the migrant housing without transportation or access to any type of sheltering. And so we want to make sure that, both employers and workers have that ability to communicate, and find the resources that they need. But I just want to take a second and see if that answered a little bit of Kathy's question. And I know she sent me in Spanish. I haven't read a message in Spanish. I haven't read that yet. But for right now, we can take some questions, or if there's anything particular that anybody wants to
Yes,
address or
and if
dive
you all
into.
have any questions, please include them in the chat. I do so appreciate what Roberto has shared and what Lauren has shared. I know some people in the audience are more like data driven, and other people in the audience want to be advocates for the farm workers. So I'm glad, Roberto, you shared about how you are doing trainings with the people to help them to understand what they can control, and providing even that re-education regarding pesticides or heat stress. That is important. Emphasizing partnerships between worker and employer, and enhancing the communication so that the needs are heard and so that they can be met. And then just addressing the policy level things that we can do, that we should be advocating for, so that the farm workers can have more protection here in the state of North Carolina. And Lauren, are your slides, or is this data available at the website that you provided?
Yes.
Okay, good. So it's public information that others can use to help understand what is going on with the emergency department visits and the peaks in visits to the emergency room. Okay, good. So are there any other questions? We have about 5 minutes remaining. So how receptive are the farm owners to changes in the number or length of breaks that will be needed? as heat stress on the field workers increases?
I speak from a cooperative extension perspective. I think it, I've been a outreach worker for a medical center, in one of my previous professional jobs, and one of the things that I've noticed being from extension is, growers have a good relationship with extension. So just the sheer name, going onto the farm, they respect what I have to say, and so from my end, I don't have any pushback. I've had a lot of positive conversations of, they want to find ways of how they can treat their workers better. um, but I'm aware that that's not all the case, and especially as the farms get bigger and some of those, family-like relationships, you start to lose some of those. Um, that's where you see some of those situations where, the the confidence or the trust feels it's a little bit less, just simply because there's not that much of interaction. But for the most part, I think, the farms want to do what's best for their workers. Right now, as a whole, agriculture is, struggling to find labor force, and that's why that they've kind of, depended on the ACE-2A program, because some of the employers are having challenges finding labor workforce, and so they need to, I think it's an awakening that they need to protect that workforce a little bit better.
Mhm.
And so I've had a lot of more positive conversations, but like I said, I feel like I speak from a little bit privileged position working with extension. And if I were, like in an advocacy group or legal group, those conversations might be a little bit different.
Yes, thank you for that. And that question had come from Brian. And earlier there was a comment from Kathy, just thanking you both and how she would like to lend her voice as an ally in this. And then Lauren, you had something you wanted to share?
Sure, I just put in the chat that I know of a national group discussing heat safety laws quite a lot, and so I just put information for connecting with that group, and I'm about to add just a link to our state health department heat related illness, but I think Roberto probably has covered quite a lot on these. I'm always deferring to Roberto and the folks doing on the ground farm worker health work, because I just mostly sit up in my Raleigh office. So.
I just wanted to share some images. This is, we do a lot of hands-on activities with the workers, and it really to continue to drive that message that, while the employer is responsible for the safety, I think it also, there's an empowering part to our training that allows workers, like we are responsible for our health, and so this is just a way that we show that. This is before the pandemic, if you're asking, but
Mhm.
the trainings can be big, they can be small, but it really, this is now the pandemic. But you can see here, these guys, this was like I went to do a training in the middle of the day during the pandemic, um, and you could already see them. They're already, wearing hats, dressed, and so I think the message has gotten, to the point where people are, following by example, especially year after year, you get new workers. Um, you want to make sure that the older guys or more experienced guys are implementing what we talk about year to year, and show that the importance. So one thing that would be good in the future is if we can track, you know, if those numbers have been going down or going up in the ag community specifically. But that's something that's always challenging. Depending on where they go and who's recording that data, once they go to the ER or to the clinic.
Right. Well, again, thank you for just calling our attention to some of these things. I think some of us, we don't see all of the detailed work that is going on the ground. So we do appreciate you and your work. There is another question in the chat about the ages of the workers' children.
Yeah, so there's a couple, it's hard to say, but you know, I'm sure there's kids that are, especially, I don't know if you guys are familiar with the migrant stream. With those migrant streams, it's a lot of the the families traveling as a family unit. And so, you know, those are some of the most vulnerable populations because, you know, most of the time they're undocumented, they're traveling with their children, and, you know, they're trying to make ends meet. I think, I don't know what the data is now, but you know, it used to be that, you know, as a family, you know, they would make $15,000, $18,000 as a family unit, and that's, you know, that's living below the federal poverty line, depending on how big the family is. And so, you know, sometimes you need the children to work, and so there's a lot of groups that advocate for that. With the A2A program, you have to be 18 years or older, so you won't see any of that in that population. But with the migrant and seasonal, you'll see high school students, maybe even, um, you know, as early as middle school. But the push is to not have children out in the area, and that's something that's a message that we're trying to send, you know, just because it is a dangerous place, you know, for anybody. So we definitely want to reduce that by not having children in those areas. But there is a need in the family, within the family unit. And so, you know, I think it's something that we want to provide, you know, opportunities for farm workers and their families to, you know, either seek other ways to engage or find financial support. You know, there's groups that are doing a lot of advocacy around that, you know, SAF, Student Action with Farm Workers in Durham, and NC Fields and out in Kingston. And I'm sure there's a lot across the country that are working to address that.
Mhm. Mhm. Well, again, thank you very much. And to all of the folks who joined us on this breakout session, you can now leave this breakout session to join the second part of the breakout session on health impacts of climate change. Thank you all.
Yeah.